Ma'am.
Hello, and welcome to the National Collaborative on Childhood Obesity Research's Connect and Explore webinar. My name is Rudy Karnick, and I'm excited to host today's webinar. Today's spotlight is NCCOR's Tools in Action, featuring the Summer Physical Activity and Friendship Study. First, we'll start off with a brief summary of NCCOR's Measures Registry Resource Suite. The suite offers 3 free resource tools that can be used to assist students and researchers with their coursework and research. Following the overview, we will hear from our spotlight speaker, Tyler Prochnow, who will share how he used the Measures Registry to enhance his summer project. Then we'll have some one-on-one Q&A time with Tyler to respond to your questions. And finally, we'll close with some NCCOR announcements. We are so lucky to be joined by Tyler Prochnow, a Baylor University graduate student who used NCCOR's Measures Registry to assist with his summer project. Tyler has research experience with social network analysis, systematic observation, intervention development, community health worker training, and implementation science. We are also joined by 2 members from NCCOR. We have Dr. David Berrigan from the National Institutes of Health and Dr. Sarah Sleva from the Centers for Disease Control and Prevention. These 2 will be available to answer any questions regarding the Measures Registry Resource Suite. If you have a question for our speakers during the webinar, please write it in the chat box on the right side of your screen. If you need technical assistance, please let us know using the same chat box. If you are having trouble logging into the webinar but can hear us on the phone, please email us at ncor@fhi360.org and we will work with you to resolve the problem. And a final important technical note, if you are listening to the webinar using your computer speakers, please turn down or mute your computer microphone. This will greatly reduce the potential for background noise. Also, we will be live tweeting during the webinar. So if you are on Twitter, we encourage you to join the conversation by using the hashtag ConnectExplore and following @NCCOR on Twitter. To start things off, we would like to open with a brief poll. You can submit your answer directly on the screen. Our question is, which of the following professional categories do you most identify with? Student, professor or educator, practitioner, researcher, or other? We'll give you a few seconds to answer the question here. Thanks so much for answering. It seems like about half of those on the line today are students, with another quarter being professors or educators, and the rest are researchers or other. Before Tyler shares his experience using NCCOR's Measures Registry for his school project, I'd like to take a few moments to provide some background on what NCCOR's Measures Registry Resource Suite is and how it can support students in their schoolwork and research. A key priority for NCCOR is promoting the use of common measures and methods across childhood obesity prevention and research. Standard measures are needed to describe and evaluate interventions to prevent childhood obesity, particularly those projects that address policies and environments. The Measures Registry Resource Suite is a series of 3 tools: the Measures Registry, user guides, and learning modules. These tools are free for you to use, will save you time, and were created by experts in the field. The tools help students, professors, researchers, and practitioners to improve their work by using resources supported by the Centers for Disease Control and Prevention, the National Institutes of Health, the Robert Wood Johnson Foundation, and the U.S. Department of Agriculture. Our resources span 4 domains of childhood obesity research: individual diet, food environment, individual physical activity, and physical activity environment. As we take a closer look at each tool, I'd like to remind you that we have 2 NCCOR members on the line who would be happy to answer any questions you may have about these tools. NCCOR launched the Measures Registry in 2011. The Measures Registry is a web-based portfolio of nearly 1,400 studies on more than 100 discrete measures related to diet and physical activity. Key features include measure type, number of items, links to full text, measures if available, study design and participant details, validity and reliability, and guidance on how to use the measure. You can search and filter capabilities by domain, measure type, age, and urbanicity. You can visit the Measures Registry at ncor.org/measures. We also have done past webinars on the Measures Registry, which you can find under the webinar archive on the NCCOR site. Even though NCCOR's Measures Registry gives students, researchers, and practitioners access to detailed information on measures in one easy-to-search location, it can still be challenging for users to choose the most appropriate measures for their work. To address this, NCCOR released the Measures Registry User Guides in 2017. The user guides are organized by the same 4 domains as the Measures Registry and are designed to provide an overview of measurement, describe general principles of measure selection, present case studies that walk users through the process of using the Measures Registry to select appropriate measures, and direct researchers and practitioners to additional resources and sources of useful information. The user guides will help move the field forward by fostering more consistent use of measures, which will allow for standardization, meta-analyses, and synthesis. You can visit the Measures Registry User Guides at ncor.org/MR-user-guides. We have also done webinars on the user guides as well, so you can find those under the Archived Webinars tab on the NCCOR site too. The user guides have been a welcome resource to researchers in the field. They are comprehensive and well-constructed, and the case studies are often cited as the most useful aspect. However, after receiving feedback from the field that we needed something designed to simplify the user guides, NCCOR developed its latest tool, the Measures Registry Learning Modules. These learning modules are ideal for users newer to research and evaluation, or those who need a refresher on key research concepts. The learning modules walk you through measurement selection on your own time through 5 to 15-minute modules in the 4 major domains. The Measures Registry Learning Modules landing page is where you can access each of the 4 domains and the introduction module. If you're sensing a theme, we also have done past webinars on the user guides, which you can find under our Archive Webinars tab on the NCCOR website. Here is an example using the Individual Physical Activity Module series. This domain, authored by Greg Welk, addresses considerations that influence decisions about physical activity assessments. The series covers why it is important to distinguish between measure and assess calculating energy costs of physical activities for adults and youth, and activity monitor selection and use. The series includes the following 4 modules. Module 1, Introduction to the Individual Physical Activity Module series. Module 2, Processing, Scoring, and Interpreting Physical Activity Data. Module 3, Selecting and Using Activity Monitors. And Module 4, Case Study, Identifying Predisposing Factors for Active Commuting in Elementary School Children who live in urban and suburban settings. And now I'm going to pass it over to Tyler for today's Spotlight.
Awesome. Thank you so much, Rudy. I feel like I'm calling into the greatest talk show ever. I mean, I've been listening to these things for a long time, and I really appreciate everything that NCCOR is doing, and I'm so excited for this opportunity to share with all of you some of the work that I've been doing using NCCOR's resources. So I'm going to be talking about the Summer Physical Activity and Friendship Study. We actually did a study with the Boys and Girls Club over the summer, and this is just a portion of that study. So as many of you might know, summer is a time of decreased physical activity, and some people have hypothesized that's because of fewer structured opportunities, supervision, and other lacks of resources, which some of these summer care programs like the Boys and Girls Clubs of America, YMCA, United Way, some of those programs might be able to fill that gap. And coming to a recent survey, we know that about 14.3 million youth every year attend some of these programs. But not much is known about the social influences that actually occur at these programs. We know a lot about the social influences on physical activity in school settings. So through selection, adolescents choose friends based on similar physical activity behaviors, or friends become more similar to each other based on physical activity behaviors over time, and then also through co-participation and concurrent play. So co-participation is when they participate in activities together. Concurrent play is a relatively new term where you're physically active in the same area, and it's kind of through social norms that it promotes physical activity. And a lot of these terms come through social network analysis, and that was one of the first things that was noted about my research interests. And social network analysis posits that the connections and influences between people might actually matter just as much, if not more, than the individual attributes. So I'll talk a little bit more about social network analysis as we go through this section, but that is a primary emphasis in this study. So the research questions that I asked for this project over the summer was how are friendships at these summer care programs related to physical activity? How do these friendships change over time? And what role does physical activity play in those changes? And in order to do that, we need to really map out the social structure or the friendships at these programs. We chose two different programs, one a little bit of a smaller program in Wisconsin and then a larger program in Texas to kind of see the differences that maybe program size would have on these influences. So to break down these research questions a little bit further, we asked questions of the adolescents and then we asked questions about their social network. So for the adolescent, we asked them to self-report their physical activity, which we'll see a little bit later how I went about picking a scale. We asked about their skill competency. We asked about their team sport participation, and then demographic questions for each adolescent. And then when we moved over to social networks, we asked them to tell us the names of the individuals that they hung around with, talked to, and did things with the most while they were at that program. This is an adapted social network question from other studies. But as you can see, we then asked them what their relation to that person was, where that person lived, how frequently they played with that person, how they perceived that person's physical activity, so how active do you think Bobby is, and then whether or not that person supported them or helped them to be physically active. So all of these questions needed to come from somewhere, which is a great segue into how we actually used the NCCOR measures. And just a real quick, I absolutely love going to the measures registry, sorry. It's just so simple to use. It's one of the first places that I actually went to when I started my program here at Baylor. I think I saw the NCCOR presentation at the Active Living Conference in Banff and immediately started using it, I think within the first semester that I was in my PhD program. Everything's just in one place. You can have a quick scope of all of your options, from physical activity to self-efficacy to environment. And it's just, it has everything in one place, and I would highly recommend it. Moving forward, what does it kind of look like? So this, as you can see on the left side, this is what you're seeing at the measures registry. You have different domains, measure types, and age requirements. So I picked the individual physical activity behavior domain. I'm interested in a questionnaire, and then I'm looking at 6 to 11 years old. For my study, we actually surveyed 8 to 12 years old, but the 6 to 11-year-old section encompassed that the most. And especially with adapting some of these things in reading level, we wanted to make sure that we were in that range. And then as you can see, there's so many results. I think this result gave you 152 matching measures. And you can scroll through those and then see which kind of measures you want to use. And if you can see on the far right-hand side, there's a little section that says compare, which is a really cool feature that you can select multiple measures and then compare those measures side by side in different domains, measure types, and down the line. So for this example, I use different attitudes measure scales that I wanted to compare. So if we look back at how I'm asking them to perceive their network, I wanted to get questions based on their attitudes, their perceptions, their knowledge of physical activity, attitudes towards physical activity. So I wanted to get a wide range of measures to compare and to kind of understand what is being asked of adolescents normally about physical activity behaviors and attitudes, and then use those questions when we're trying to understand their social network. So these comparing measures is really important so that I can go side by side and see each measure and kind of compare between them. So when we are looking at the individual measure, so when you actually selected one, so for our physical activity, self-reported physical activity, we chose the Health Behavior in School-Age Children questionnaire. We chose this one because it was a relatively low item number, and we chose this because we can ask very similar questions to the adolescent as we would ask about their social network. So we wanted to be able to compare if they perceived a very similar physical activity for themselves as they perceived with other people in their network. And as you can see in here, it has a full abstract, and then at the very bottom it has a full text link, which is super helpful. And I think what is even better is the at a glance. So the next side, there's different tabs at the top. So if you go to at a glance, I always look for measure availability and for the measure to be included in the article, because that is super helpful for you to be able to go to that article and actually get the measure instead of having to maybe email the PI on the project or something like that. So to be able to have the measure that's actually included in the article, and as you go down, number of items, there's 5. So we wanted a smaller number of items for each survey, so we went with one of these scales while still being reliable. So that's another tab in the same domain here. So you can look at the reliability test right away and see that it had very good, moderate test and retest reliability. So it's a measure that we would want to be using for this study. And going forward, some of the other ones, so you have study design, how to use, and validity. These tabs are also used in various different profiles. For this individual one, I picked these 4 tabs or 3 tabs because those are the ones that I use to delineate this particular measure. So for outcomes of our study, moving forward, there's 3 main outcomes that I kind of want to be talking about. So we had cross-sectional results, we had longitudinal results, and then network perceptions. And then I'll go into next steps and where we see this project going forward. So I know this is a little bit text heavy, but I wanted to get everything on one screen for cross-sectional results. So the perceived skill of the individuals, of the adolescents at these networks was spatially correlated. That means that the adolescents' perceived skill was significantly associated with that of their friends. They were more similar in physical act or in perceived skill than people that possibly weren't friends. So we're seeing that these pockets or clusters of adolescents that perceive themselves to be very competent in physical activities. So that's basically saying that, you know, when we are looking to program and when we are looking to increase skill levels at these programs, we might want to look at the social circles and how we might be able to possibly change the social circle and incorporate more collaborative skill building. The next one down, friendships are mutual and occur between adolescents of the same age and sex. So this might be common sense if you think about it. If Bobby says that he's friends with Billy, Billy will probably say that he's friends with Bobby. And then most likely those adolescents are the same age or similar age, and a lot of boys tended to nominate boys. Girls tend to nominate girls. When you're thinking of adolescents 8 to 12 years old, this makes sense. The next point down, self-reported physical activity was associated with more nominations. So the more they felt they were physically active, the more friends they said they had. But the adolescents that perceived themselves to be more physically active, or the adolescents that said that they were more physically active, sent less nominations. So they actually said that they were friends with less people, but they had more people saying that they were friends with them. So I flipped that around to begin with. Sorry about that. So to reiterate that, adolescents that were more physically active had more people that nominated them as friends within these networks, but they sent less nominations. And we're still trying to parse out why that might be, but we thought that that was a very interesting result. Similarly, physical activity increases the odds of connection in the larger program. So in one of our larger programs, physical activity was a very important aspect of connection, but in the smaller program, over time, we saw that it wasn't. And we have more longitudinal results that kind of speak to that as well. So in our longitudinal results, we saw that over time, adolescents formed friendships based on similarity in physical activity. As I said in the introduction, adolescents tend to become friends with other adolescents that are similar to them in physical activity. We saw that at the larger program, but we did not see that at the smaller program, which was kind of interesting, and we might think that in the smaller program, they had fewer opportunities to make friends with adolescents that were similar to them in physical activity, so it resulted in them making friends regardless of physical activity. And the other main result that we saw here is that there's large friend turnover or change in friend groups, and this might be because of the very transient nature of participation in some of these programs, where they might come for a month or two and then leave on vacation, or they might be staying with their family in another location, and they might only be there for part of the summer. So we saw a lot of change in these friend groups over time, and that kind of showed up in different ways with both the larger and the smaller networks. And finally, so our network perception. So basically, we asked each individual how physically active they thought their friends were. And we kind of pooled those results. So if one adolescent had 5 people that said that they were friends, or said that they were friends with that person, we averaged all of the perceptions of that person and gave them a network perception score. So basically, the more physically competent and central adolescents, so the people that were in the middle of the network, were perceived to be more active on average. And then we also found out through those network perceptions that adolescents perceived similar levels of physical activity for their friends as themselves, regardless of how active that individual actually said that they were. So moving forward, since we did use a lot of self-response, self-reported physical activity, we are moving forward with doing accelerometer objectively based activity measurements. And then we are also looking to use Network Canvas, which is an iPad app to collect network data more frequently over the summer. So this summer we are pilot testing a self-collection technique. So it would be like using a kiosk in the Boys and Girls Club to have the kids select their own social network. So they'll be able to go on there, report their social network each week with little to no researcher intervention there. And hopefully this will be able to give us more snapshots over the summer to be able to really understand that change that I was talking about, how these networks change over time. And if we have more of these snapshots and more of these frames that we can model, we might be able to better understand how physical activity plays into those more frequently changed networks. So lastly, I saw that there was a lot of students on here, and I would highly recommend this for students, but regardless, it's a tremendous resource. But really just look and use all the resources that you can. Take advantage of those opportunities. Like if NCCOR asks you to do a webinar, just take advantage of that. And use every opportunity to its fullest. And ask questions and reach out. I remember sitting in the presentation at the Active Living Conference and just asking questions about how to use the measures registry and things like that right away. But I think the biggest thing that you can really do is just to start using the resources that they provide you. And I think when I started into the program, these kind of resources were something that I leaned on, and I didn't have the learning modules at the time, and honestly those are a tremendous resource now that you can go through some of those things and learn about that without having that necessarily in your formal training at your school. When you start up a program, sometimes it's not necessarily given to you all at once. So for you to be able to go out and find some of these resources on your own, it's probably something that can give you a leg up and have you better understand some of the things that you were learning in class as well. I'm thinking that's all I have. But let me see, I see a question here. So a little bit about my formal training. As part of my PhD, we did take a evaluation class, which actually the professor for that class instructed us to use NCCOR as well. So I I was like, yep, already using that. It's a great resource. But I think it's something that you can definitely pair with some of the classes that you're already taking, and it provides you with a more convenient way necessarily to do your literature search on some of these measurements. And I think that's where I'll end and see if there's any questions.
Thank you so much, Tyler. We're just going to continue with that Q&A. We've compiled some questions that were emailed to us in advance of the webinar, as well as any questions you all sent in during the webinar. So we'll try our best to get to all of the questions. If there are any remaining, we will ask Tyler to respond in writing, and we'll include these in the follow-up email that we'll be sending to all participants of today's program. So Tyler, one of the questions we got is, how do you see your project and dissertation impacting the larger physical activity sector?
Yeah, that's a really good question. So my dissertation is going to be what I described kind of in my next steps. So to be using these accelerometers in very frequent snapshots of this network. And I think right now we know a lot about social networks and social network change regarding physical activity during the school year. But right now we don't know much about the summer and how those social networks change over the summer. And it's such a crucial time for adolescents and their health behaviors. And for us to be able to, I guess, understand what might be going on socially during that time might help us better develop programs to encourage individuals to be active and maintain those active habits during the summer.
Great, thank you. Just a reminder, if you'd like to ask Tyler a question, please use the chat box on the right side of your screen, and we'll address it during this Q&A segment. Also, if you have any additional questions about the Measures Registry Resource Suite, Dr. David Berrigan from NIH and Dr. Sarah Sleva from CDC are happy to answer your questions as well. Tyler, could you talk a little bit about how you're sharing your results with the Boys and Girls Clubs and what they're most interested in from your research?
Yeah, so the Boys and Girls Club is really near and dear to my heart. When I lived in Wisconsin for a while, I volunteered there. We organized 5Ks for them and things like that. And anytime that I get to work with them is just a plus in my book. I walk into a new club and instantly get inspired by some of the just passion these individuals have for the youth of their community. It's just great. And when I'm talking to them, they're most interested in how they can use this information to improve the lives of their youth. So we're talking about, can we share real-time information with them regarding social networks? Can we use this kind of information to maybe help them program differently throughout the summer? And I think they're really interested in this collected data that we're working on and piloting this summer, because it's something easy that they can put into their centers without much work and without much intervention on my part. So I think that part is really exciting for them, and it's something that they can hold on to and they can grasp. I can show them a graph and a chart of the individuals and see the different clusters, and they can picture those people. They can see the social interactions that are occurring, and it's something that they're really interested in learning more about.
Great, thank you. This next question is for Sarah from CDC. What's the value of using the Measures Registry Resource Suite in your work? Why should public health students and professionals be using these tools?
Thanks for that question. Yeah, so I'll answer both. So I'm speaking, I work at the CDC, but answers reflecting my personal perspective. It's not necessarily the official position of the CDC, but we do a lot of work where we're trying to scale up things that seem to be working well. So we fund public health departments, we fund departments of education. We don't really focus on research. We're really looking for evaluation often. And so building from what's already there, what's already been meticulously developed, pilot tested, psychometrics have been conducted on them, it's really a huge benefit in terms of making the most of limited funding to be able to draw from tools that have already been developed. It's a huge draw. I used to co-teach a course in theories of behavior change, and I would always promote these resources to our students because they would often be looking for tools to use as they were thinking about developing surveys or evaluation products, and I have really promoted this as a good place to start.
Great, thank you. David, do you have anything to add from NIH's perspective? David, are you on mute?
Yes, I was on mute. Sorry. I had such a good answer for that question, but it's too late now. So thanks, Tyler, for a terrific presentation. And I think in response to that idea of the value of the registry, I would echo some of what Sarah said. The NIH goal is really to understand the causes of adverse health outcomes, and to do that, takes more than a single study. It takes multiple studies with valid measures. And so, if we can help encourage people to use the best available measures and to move towards harmonized or equivalent measures, that can help accelerate, reaching a consensus about the steps to address health inequity. And so, in this field of childhood obesity research, we don't have a lot of, consensus yet on specific measures, but the measures registry and the whole suite of measures tools we think is serving to help move the field towards better and in some areas more harmonized measurement. And that can only accelerate progress against this serious health problem.
Thanks, David and Sarah. Tyler, social network analysis seems like a very unique methodology. How did you get your start with it, and where would you suggest our viewers go for more information?
Yeah, so I got started with it about my second semester at Baylor. One of the professors here was using it, and I was just always kind of interested in things like that. I was always interested in social interaction, and my mentor said that I should probably talk more to this person, Meg Patterson is her name, and try to see if there's a study that we can do as a directed research program. And ever since then, I've been reading every book that I can. I've been attending workshops and webinars and things like that. And it's a really interesting methodology to use to kind of understand the connections between individuals and how that might impact their health behaviors. And this can be, collaborations between organizations in a health coalition or social interaction, things like that. But for individuals that are looking for social network analysis and how to get started in that, there's a few different resources online. The Duke Network Analysis Center, that's a very good resource. They have a lot of videos online with that. But there's also a lot of books. Tom Valente has a good book out about social networks and health. And then there's also several conferences that are looking to do social network things like Sunbelt, which is the International Society of Network Analysis. That's coming up, and then also a few different like SBM, ALC, they all have certain social network analysis people that sometimes do workshops for them. So go ahead and check those out.
Great, thank you. We got another question. This is a great tool. Is it available for everyone to access and use? So I'll go ahead and answer that question. These tools are all free and available on the NCCOR website. If you look in the chat box, we've just added the link. You can also find it in the web links section on the right side of your screen. We've linked the Measures Registry Resource Suite as well as NCCOR on social media. You can find all of this at ncor.org. Tyler, we have another question for you. Do you have any advice for students in regard to how NCCOR's resources can help their work?
Yeah, so a little bit more, I guess, background on me. Before I came to Baylor, I was a campus recreation specialist, so I didn't have much research backing. I didn't really know where to go, what to look for, what kind of research is out there really other than just writing a master's thesis. And like I said, I stumbled upon NCCOR at the Active Living Conference, and it's really just opened my eyes to what is actually out there. And this is a really good thing about NCCOR is it has all of these measures that are already created and already validated and ready for you to use. So it's something that is kind of like a plug and play, and there's so many different options and different categories for you to pick. There's a lot of information on there, and I just would say start going for those learning modules as soon as you can. Those things will help you get a little bit of a leg up and better understand how best to evaluate and measure physical activity or diet or whatever is your obesity research modality, I guess.
Thanks so much, Tyler. On a related note, we have one last question for David. These tools seem like a great resource, but where do I begin if I've never used them before?
So good question. And, normally I would say, and in the past I would say, read all 4 75-page monographs very carefully and everything will be on the quiz. But I think now one of the best places to start is to look at the learning modules and pick out some topic areas that seem relevant to the challenge that you're addressing, be it physical activity, diet, or the environment. And those learning modules will give you some of the flavor of how NCCOR is addressing measurement. Then you can simultaneously delve into sections of the guides themselves for a little more detail and use that information to think about how you might start searching for specific measures relevant to your project. So that's kind of assuming, and I sort of jumped ahead, assuming you already have a question in mind. So in parallel with learning all about measurement, you need to be thinking about how to hone in on the question that you want to answer, because it's hard to know what to measure unless you have clarity about what question you're trying to answer. So those are the two sides of the coin, I think, of trying to increase your skill set in measurement relevant to childhood obesity.
Thanks so much, David. Now, before we let everyone go today, we just have some final NCCOR announcements. And just wanted to share some upcoming events. Be sure to sign up for our newsletter to be the first to know about upcoming events, including our upcoming webinars. And make sure to indicate who you are to receive tailored information. You can check out NCCOR's Student Hub webpage on the NCCOR website at the Student Hub tab listed here. If you have used or plan to use NCCOR's tools, like Tyler, make sure to tell us how using the NCCOR email, ncor@fhi360.org, and you could end up being featured in one of our webinars. If you'll be at SOFI next month, NCCOR will have a booth at Georgia Hall. We'll also be giving a short talk at the student workshop on Wednesday, March 18th from 11:15 to 12:45 p.m. If you have any further questions about NCCOR or any other upcoming activities, please email the NCCOR Coordinating Center at ncor@fhi360.org. To access the webinar recording, click Webinars on the top navigation at our website. All the upcoming and archive webinars are displayed there. Thank you again to Tyler, along with Dr. David Berrigan and Dr. Sarah Sleva for joining us on this special webinar, and thanks to all of you who attended. Before signing off, please take a moment to complete our brief survey to help shape future webinars. We'll switch over to the feedback form now. You can write your input directly on the screen and hit submit. Thanks, everyone.